Yeah, I'm talking with Samia. We had already a small talk and we had a lot of technical problems to solve before we started. Today I actually I wanted to let you tell us about your journey from med school to Dubai, finally ending up in Dubai, and how that all unfolded.
Yeah, so I graduated in 2012, did my MBBS, and after that I did my internship for a year.
Where did you do the internship?
I did my internship in Karachi, Pakistan.
Mm-hmm.
Yeah.
And how was that? How do we have to imagine? How was the internship for a student in Karachi? And I mean, I remember my internships. They were like running around with a doctor, getting something shown, and doing minor things in the hospital, getting to know the hospital business basically, or not the business, more the what's happening in a hospital. How was it like this?
So it was, you can say, after the MBBS, it was the first, the exposure to the real world, to the hospital world. So you're the junior most doctor working in the clinic, and it's your first time. So you're just exploring things. You're seeing patients from wide, vast, patients from different cultures. Because Karachi, it's the metropolitan city of Pakistan, one of the biggest cities. So people from all over the Pakistan, they were visiting Karachi for the healthcare needs, and I was working in one of the most biggest you can say a tertiary care hospital under the government. It was a government hospital where I worked, and my first posting was in pediatric ICU, NICU. My first posting was in neonatal intensive care unit. And first clinical exposure, and it was in NICU, seeing infants, seeing newborn babies in incubators. So it was challenging for me. And drawing their bloods.
Drawing the blood from a neonatal. Oh wow.
Yes.
Infants.
Yes.
That's really difficult.
Yeah, that was difficult. And after then my first rotation was in pediatric ward, and my first month was basically in the NICU, and then I was posted in the pediatric wards, and finally to the adult medicine ward.
Wow.
Yes.
Wow. And then how did it continue? Tell me some of the stories that you encountered on this trip.
It was good. Something I remember that one of the kids got exchanged in NICU. That was one night we saw that, because there was this lady. She gave birth to twins, and obviously they were not in good health, so they were shifted to the NICU of the hospital, because it was a government hospital. So the security and rest of the things were not that up to mark. So there was one night during my on-call shift during the night. So one of the kids, they got exchanged with the kid of other family. They took the kid, and then and the family was like, because one of the families was Pathan. They had the Pathan are basically from Pakistan. They're like white colored. They're fair people. And the other family who took the kid, they were not Pathan, so basically they were from the Urdu speaking background, and their skin color was darker than the Pathan ones.
Oh my God.
So I don't know what happened. They took one of the twins of the Pathan family. So
who was in charge? Were you in charge?
No, I wasn't in charge. I was the junior most. And this happened in one of my first rotations, so it was quite awkward for me. And then the administration got involved, and
But they solved the case.
Yeah, they solved it.
But
because the people who took the child, who took the infant, even they didn't look whose baby they're carrying, because maybe they were, they got discharged and they wanted to go home quickly. Maybe that was the thing.
So everything was resolved amicably.
Yes.
Yeah. And then how did it continue then for you?
Yeah, so for then after that, I was posted in the medical ward, and I did my rotation in the medical ward for 3 months. And even they had a ICU in that particular ward, so I was also taking care after of the intensive care patient units and in the medicine.
Yeah, so how did it continue?
So from medicine, after that, I was posted to the emergency department. That was the real world. I used to see gunshots. Even one of the episodes which took back and took place in the Karachi back then. Bomb.
Bomb blast?
Yes,
Oh my
bomb
God.
blast. I was on duty when most of the injured were brought there. All the casualties, even the dead bodies. You would see people without their limbs. And it was very chaotic. But
And you were still an intern, or
I was an intern back then.
still?
Yes, I was an intern. But all of the administration got involved. Doctor from different units, they were present there. So it was a big help. Like not only the doctors of the emergency, but from different departments. They were on red call, and then everybody came, and it went good. Obviously,
What was the takeaway for you from these incidents that you encountered, or that you saw there? What was the learning? How did it?
I got the confidence how to deal with the patients, how to deal with the situation.
Exactly,
Yes.
Yeah.
I feel, because when you work in such a overwhelming situation, or from these experiences, you become more confident in dealing with dealing with variety of diseases or the conditions or the situations. I think these life experiences, they make you more confident and more experienced.
Yes, I think so too. And naturally, people run away from scary situations. It's also affecting helpers or medical helpers, health workers and doctors. But once you know exactly the steps, step 1, step 2, step 3, how to deal with any injury, look after the pain first, and put the anesthesia or whatever, look after the blood circulation, and always the ABCs basically.
Yes, the ABCs, the comfort.
Then if you have done that a couple of times, you can really help, and you're confident to help.
Exactly.
So actually, I have a funny story that I encountered in such a situation, but this is for a different talk. How did it continue then for you after you finished your internship?
Yeah, so after doing my internship, I worked for an emergency department of one of the hospitals, Al Khan Hospital. I was there for around 18 months. And then finally, I wanted to pursue a field, a specific field for my career. So I did my training in dermatology. And
why did you choose dermatology?
Maybe we don't have night calls.
So you didn't like the night calls?
I don't know. It gives me an anxiety. I can work the whole day, but I want my sleep at home. Maybe because of that, because you don't get any night shifts in dermatology when you're working, and you can make a work-life balance, because I have a family, I have a daughter, and you have other things to do.
So you chose to do dermatology, and then where did you go then? Did you still stay in this government hospital in Karachi, or did you?
I did my training from another government hospital, civil hospital, and but after that I was working privately.
And in the during the training, how was that? How can I imagine your training in dermatology? How did that go?
So our typical work day started around 9 o'clock with the morning rounds. So whatever patients were admitted in the ward, we used to do a round and take out the orders.
Which kind of cases did you see there? What was the most common case?
Pemphigus, it's a autoimmune blistering condition, psoriasis, even cutaneous T-cell lymphomas, and all the blistering conditions and fungal infections, systemic fungal infections, and erythroderma, which is, when you have any reaction which causes all your skin to get red, ichthyosis, SLE, systemic lupus erythematosus. So different kind of conditions.
So
even derma wards were busy.
Relatively rare diseases as well. Ichthyosis is rare, isn't it?
Ichthyosis is rare, but it was common in dermatology department. Yes.
And emergencies?
In emergencies, we used to see Steven Johnson's and toxic epidermal necrolysis, TENS, which we call it. So these are the severe, reactions or reactions secondary to any diseases or any drug reaction. Yes.
But those situations, they also need to be treated by the internal.
Yes. So basically, according to the condition of the patient, we were, if the patient requires intensive care unit, so patients were admitted in intensive care unit under our care. Yes.
You've been also working in intensive care.
Yes, in my internship, I was seeing the patients who were admitted in intensive care unit, and then when I was working in ER at Aga Khan Hospital, I used to get called when I was rotated in internal medicine. I used to see patients there, and even in dermatology.
So before you went to dermatology, you were also working in that was the ER which you were talking about. Yeah. How long was your internship?
My internship was for 12 months, but then I did an additional job in emergency medicine for 18 months.
So in total you did...
So I have a vast experience of emergency medicine, you can call it. I was also working at one place in pediatric emergency department for 4 months. So I have more than 2 years of emergency medicine experience.
And your dermatology treatment, your dermatology experience then started not only when you joined the dermatology ward or the dermatology clinic, but also before you got already some dermatologic diseases, some encounter with dermatologic.
So
diseases.
In ER.
Burns,
not
maybe.
much burns. I've seen Steven Johnson's in ER, and sometimes patients would come in the ER triage with complaints of herpes zoster, shingles, which we call, and nothing.
Just to explain this to the non-medical audience, the diseases that Dr. Samia just mentions, the names are not so common for everybody, but it's basically rushes or blisters with different background and different severity. And the skill of a dermatologist is to understand which lesion means which disease, and that's actually the challenge here. So you need to be a very visual person, yeah.
Exactly. Dermatology is all about, what
observing.
you see by your naked eye, and then go and biopsy it. That's the most, or you can examine it with a Woods lamp or a dermatoscopy. Bloods, they help less, but your naked eye should be very good in catching the
So how many years did you stay there in the dermatology department?
I was there for 3 to 4 years, and then I was working privately for 2 years.
And you also then encountered also the beauty part of dermatology.
Yes, obviously, because this trend is very demanding these days. So there are very less people who are practicing only dermatology, because this is a demand of your field. So patients, they come and they ask for aesthetic procedures, and you cannot say no to them. So you must be updated with all these aesthetic procedures as well. So I got training for fillers, Botox, all the aesthetic procedures.
Also threads?
Threads as well, yes.
And then you decided to go to Dubai.
Yes. Then finally, I wanted to experience, initially, I was planning to move to UK, but then we said, let's see. Let's explore Dubai.
Yeah.
And also my husband, he wanted to explore the Dubai market as well.
Yes. Mm.
So I think it's also nearby to Pakistan, so traveling is also easy.
Yeah.
And let's see how it goes. We're hopeful.
It feels not so far away here. Yeah.
Yeah, it's only 2 hours, not 2 hours, less than 2 hours maybe from
that's
Pakistan
cool,
to
yeah.
Dubai. Yes,
Very
and
good.
also the time difference is less. Like Pakistan is 1 hour ahead of us.
That's amazing. Good. Good. So yeah, is there anything you wanted to share with us? Anything else?
Yeah, so I'm loving it here till now.
Yeah.
It's only been 2 months, but it's amazing here. Just waiting for my family to come.
So actually, you strike me as a doctor with a vast experience already in your young age.
Yes.
You've had 8-9 years of experience.
Yes,
in
I graduated in
internship,
2012. Yes.
in emergency, like in total 3 years. Then dermatology 4 years, and another 2 years in beauty. So you give everything, and it's still fresh in your brain. So you're the right person for this place here. This is what the people, I think, need. Yeah.
Yes.
Thank you for coming and sharing this with us.
Thank you so much, Dr. Mueller.
Pleasure.